Thank you for joining the 12th Annual PIPC Forum. It's hard to believe that it's been 12 years. I'm grateful to see our progress advancing the voices of patients and people with disabilities in research and healthcare decision-making. We have come a long way, but we have much more to do. The United States Congress passed the Americans with Disabilities Act over 30 years ago because of one thing: disability is not unique to any political party or demographic. My friend Bob Dole, a disabled World War II veteran, recently passed away and reminded me yet again the importance of this fact. Bob said, "Having a disability changes your whole life, not just your attitude." When I think about some of our greatest achievements in the disability community, they are often the result of what unites us. A quarter of the population is disabled, and half the population is connected to disability somehow. That means many people understand the value of accommodations and the need for policies against discrimination. Because of great people like Bob Dole, the ADA had bipartisan support. Later, the Patient-Centered Outcomes Research Institute, or PICORI, was created because members on both sides of the aisle came together to draft the original bill that was eventually included in the Affordable Care Act. Today, we hear from the chairman of the National Council on Disability, an important federal agency, about its work to advance the promise of the ADA. I can say without a doubt that their work has been tremendously influential in everything that we do at PIPC. When we were working with Congress to pass the legislation creating PICORI, we thought that the bar on using quality adjusted life year by Medicare was enough. However, the National Council on Disabilities report in 2019 told us we still had work to do. The use of quals rising and not falling means that we were seeing discrimination in healthcare rising, not falling. Discrimination is not always out in the open. When decisions are made about people's access to care based on averages, those of us who are not average are disadvantaged. Treatment may be more beneficial and critical to us than average patient. That is why we wanted so badly for PICORI to be created and to focus its work on how treatments impact different people. We wanted information on what works, for whom, and why. We not only need to fight for more information that helps us personalize our care, we must fight against policymakers and payers using information about the averages to limit or restrict what we care and can get. Having epilepsy myself, I understand this all too well, since I must change my medications when they stop working. We know from our own surveys of people that regardless of political party, people want to receive the health care that their providers determine will achieve their goals. They do not want cost effectiveness to drive decisions about our care. When that happens, we are telling people living with disabilities and chronic conditions, people with expensive care needs, that we aren't worth it. In my view, this is a violation of the ADA and Section 504 of the Rehabilitation Act. I'm willing to fight to do everything I can to support the National Council on Disabilities efforts to get a full ban on the use of discriminatory metrics like the quality adjusted life year in the Build Back Better bill, and to do what I can to support their recommendation that disability rights laws are enforced against the use of these discriminatory metrics in Medicare and in state Medicaid programs. I would add that people with disabilities need to be engaged partners in decisions made about the value of their health care. I'm grateful that Democrats and our Republican colleagues are with us in this fight. President Biden has stated his opposition to the quality adjusted life year. The DNC platform explicitly opposes its use. Senators of both parties have written letters acknowledging their historic discrimination using discriminatory metrics like quality adjusted life years. With such tremendous public and political support, I hope we can come together to advocate alongside the National Council on Disability to, as they say, unambiguously ban the use of discriminatory metrics in value assessment from being used in federal programs like Medicare and Medicaid. And I want to personally thank the chairman of the National Council on Disability, Andres Gallegos, for presenting to you, our audience, today about their work. If you've not read his piece from earlier this year in Health Affairs, I would urge you to do so. He captures the stigma that leads others to view us, disabled people, as having a low quality of life. And he outlines explicit steps to ensure that we do not devalue disabled lives in our policies. He's carrying on the fight for people with disabilities, and I could not be more grateful and proud of him. In closing, I appreciate all of you for being here and for listening. I hope you will join this fight with us. Thank you.